Hi everyone, welcome back to my YouTube channel. In today's video, I will be asking a new grad a few questions because she just took the Nclex exam. Yes, I know you have questions. I also have questions to ask her, so I'm really excited about this video and I feel like it will be helpful for you as well as you're preparing to take the Nclex exam. So I hope you find this video helpful. Stay tuned. Okay, so this is the latest RN in town, guys. Okay, so please introduce yourself to my people.
Hello, my name is Nancy Nclex. That's actually my
She has a YouTube channel, by the way, and I'll link. She has amazing videos. So Nancy, how are you doing today?
I'm doing well.
First of all, you look amazing.
Thank you.
Thank you for being on my channel. Thank you for agreeing to doing this video with me, because I know a lot of people are preparing for the Nclex exam now, and I mean, you can tell that it's a lot of pressure, right? Like when you graduate. Yes. So you are fresh out of that heat. She's fresh out of that heat. So she'll be able to tell us, things. All right, so we're just going to start questions. I just have a few questions to ask you. I hope you're able to answer us to the best of your ability.
Of course.
Thank you. I'm very honest on this channel, please.
We are.
Do you mind just saying when you passed the Nclex, when you took the Nclex, when you graduated also, just so people can,
Right. So I graduated December 2024. Okay. And I took the Nclex March 4th and summer results March 6th. Yeah.
She went straight.
I went straight up. I just needed to get it out of the way. I went straight up.
That's really good. That's really good.
My advice is actually to go straight up, honestly.
Okay.
So, because you still have so many things fresh. Because when I started studying, psych was easier for me to study because we just did psych and community.
Yeah,
so everything was
so
fresh.
Yeah. Memory. All right. First question is, how did you feel when you found out you passed the Nclex exam?
I actually cried.
Aww.
I know, because we have to wait 72 hours to see the results. When you pay the $7,
it's like the longest 72 hours of your life. Yep.
Oh my god, I had to watch so much K-drama to just free my mind, but it wasn't working. For the first time, K-drama wasn't working for me. I'm serious. I was so nervous about it. And then I still having flashback of every question that I had.
Yeah.
I'm like, did I do it right?
Asking yourself, hey.
Jesus, I doubted myself, and it was bad. It was so bad. I was so relieved when I saw the result, and I just cried.
I'm so happy for you, to be honest.
Thank you.
Okay, second question says, what study resources helped you the most?
Okay, I used ACHA review for my study. I remember I kept asking you about what should I use? Everybody's using whatever one using this. Well, I just found ACHA review to be very easy for me to use. The explanation after every question it was really good for me. They gave me good questions and good review. And basically, when I answered the question in the Nclex, I feel like ACHA review prepared me very well for the
more. So ACHA was your own thing.
Yeah, ACHA was my own.
I mean, I said that in my previous videos, that whatever works for one person might not work for the other person. Like for me, I never used that at all.
Many of my classmates use UWorld.
UWorld, yes, I had UWorld. Okay, third question. How long did you study? And what was your daily study routine like?
So another thing for this one, do what works for you, honestly. But what worked for me was, I started studying the last week of January. The only thing I did was study. I studied for 6 weeks. 6 weeks was my plan. I did 85 questions every day and remediated 85 questions that same day.
Wow.
We had a group chat and my friends. Okay. So we were I just completed my 85 questions. I'm not here, I'm this. So we kept in touch.
Good. So you guys were...
We had a group chat, we had to be accountable because we got tired. You really get tired.
Yes.
So we needed someone to be patting us on the back, something like that, or just calling us out when we are falling back. So I did 85 questions and we did 85 questions every day. And any topic that I find myself falling short, I watch a YouTube video on it and all of that.
To understand better.
Yes.
Okay, that's good. So that means you weren't working.
I was not.
Dang.
Oh my goodness. I was not working. I had to put everything on hold.
Oh wow.
Just face it.
That was a very bold step.
It was, honestly,
because God forbid you did not pass. on your first attempt? Because that would be a lot. Then you have to start thinking of pressure of like going back to work. You have bills to pay.
True.
Like,
and I live in New York. Just imagine.
Yeah. The fourth question. What was the hardest part of preparing for the Nclex?
The hardest part has to be being consistent. That is just so hard, especially when you see, especially the first week of studying, when you do the questions and then your score is like 57 or 47. Like,
but you have to keep pushing.
Jesus Christ. No, it can be very discouraging when your scores, when you start up and your scores are not, some people are saying they are scoring 70 something on the practice, and then you're all like, oh, what's going on here?
It's funny because I remember like a night before I went to take my Nclex exam, I did like a practice question on UWord, and I had like, it wasn't a good score. And in my head, I'm just like, listen, this is like my 5th attempt. Okay, like I'm just going to go and sleep. I'm not going to let this get to me. But again, that's really hard. Like you have to make up your mind. Like you have to set your mind to not give up. Honestly, it's hard until you find yourself in. Like it's not something you can teach someone to do. Like I feel like you have to personally, do it. Yeah.
You have to just do it for real.
Yeah, I can imagine.
No, I think what actually motivated me more was the fact that I was not working. So I knew for sure that I knew for sure that I need to put in all I have into this preparation because Nemo, we have to get money somewhere. We have to be done with this and get our feedback.
Yes.
So I think that motivated me. And then my friends as well. My friends, the group chat was really helpful. Like we were just 3 in the group chat and we kept holding each other and pushing each other.
Those are good friends.
Yeah,
those are good friends. Find yourself good friends. All right, so this brings me to the next question. How did you manage stress and anxiety while studying? Because I'm sure there were times that you were just like, you probably didn't even understand what you were reading or studying. Like, am I even understanding what I'm studying? So how did you manage that?
My own management of anything stress is just prayer. I just pray. I keep reminding myself that I have the spirit of excellence in me. I keep reminding myself.
Come on.
I just pray. I just keep praying and encourage myself with the word of God. Honestly, that's my own. That's how I keep moving in life. Regardless of anything. So that was that praying, and then I became very honest with myself. Okay, pediatrics is really hard for me. I need to go and watch videos on pediatrics. I need to go and educate myself on this topic. I'm not saying, oh, I'll get it right tomorrow. If I see now that this is
you act on it.
I act on it immediately.
So no procrastination.
No procrastination at all, because I know that procrastination, date of exam will reach, and then or what now?
True. Very
so true. I had to even write down every topic that is difficult for me. I wrote them down. As I answered the 85 questions today and remediate 85 questions, remaining time I have, or like maybe an hour or 2, I will watch videos on those topics I wrote down. So I watched those topics. My school made us get host review. It was like mandatory for us.
Okay.
So and host review, they have this video review.
Yes.
So they have this video review, and it was so good. We watched. I watched all the videos, but the questions, it was kind of difficult.
I also, I feel like the questions were really weird.
Yeah.
Even though someone actually used hers.
My sister used hers and passed. She used only hers and passed. But me, I
found the questions weird. I found the videos helpful.
The videos was very helpful. I did all the videos. The videos very helpful. But the questions, I was like, it was discouraging for me. I was like, oh no, I cannot keep up with. I don't need this feeling right now. I did like 90-day plan with Archer review.
Okay.
And it was like just the Q banks, nothing more. And it was like $85. So it was affordable. And I was like, okay, let's use this one. So yeah.
So you're still, spending, being prudent, even with spending.
I was.
Of course, because it's not a job. All right. Okay, so next question. How many questions did you get on the Nclex? And when did you feel confident about passing? So that's a 2-in-1 question.
Okay, so back to ACHA review, right? So ACHA review, they have this readiness assessment, normal Q bank, just you select your 85 questions and all of that. My exam was like March 4th, right? So the week before March 4th, I started doing readiness exam every day. Readiness exam is like, it's more difficult. Yeah, it's more difficult than the regular. I feel like it's more difficult. So, and then they have this like, you passed or you fail. It's like giving you the Nclex vibes.
Yes.
kind of. So I started doing that every day. And then my confidence was that I was like in the 70s. I was in the 70 something. Then I got,
that's good.
The day I got 80 something, I screamed. I was like, okay,
I have made it. Mommy, I've made it.
So that was what I did. And that was what, like, okay, let's go for these dates. Because the first date I picked was the March 4th. So when I did the readiness exam and I saw that my scores are really high, I was like, okay, let's go write the exam.
Good.
And then in my exam, I was really confident. Like, I got so much case studies and all of that. But so that was actually that threw me off. The case studies threw me off a little bit because I got a lot. Normally they say it's like 3 case studies, but I got like 7 case studies. Well, so I thought my questions was going to go like above 85, but it did not go. At 85, it actually stopped. 85.
So you passed at 85 questions, 85 guys. Yeah. Oh my god, that is amazing.
Thank you.
Because I mean, people fail at 85 questions.
No, and that actually scared me because
you just don't know.
Yeah,
you never know.
That's
like, I remember
that 85 questions scared me until I actually saw I passed.
Yeah, I remember my questions going past 85, and I'm just like, hey. Hey, village people. You are very rich again. I had to go outside and I started kabashing. Oh Lord God Almighty. Affliction shall not rise again the second time. Village people are real.
No, they are not real.
But my God, the God I serve is higher than them. But anyways, what surprised you the most about the Nclex exam? Were there any surprises? Did you feel like you got any questions and you're like, dang, I've never seen this?
I did not get any. Okay, just the case studies. The case study was just, it was a low, and it was like easy, moderate, hard, hardest. I kept going like increasing difficulty. So that was just the only thing that threw me off. Other than that, other questions were like, pretty much, I've seen something similar, or I've seen something like, I kind of knew how to deal with the questions. And another thing I did was watch Dr. Sharon on YouTube.
Dr. Sharon, okay.
Yeah, she has this prioritization videos,
techniques,
how to. So
because I was just going to ask you, like, do you have like a technique on how you answered your questions?
Whether Dr. like Sharon prepare you. I did also. I did Mark K review.
Yes, Mark K.
Yeah, I did that as well. So I watched his videos. There's Dr. Sharon on YouTube. Maybe you should share the link on your description.
Okay, yeah, I'll add
it helps me like crazy. Even when I do not know the way she'll prepare you for that exam is like you don't need to know the answer to this question,
but you can
just think. Prioritization.
Because the guy I used, Dr. Zishan, that was how he actually taught his students. Like, he taught us how to actually, when you see a question, how to answer or read the question, how to read the question and how to answer the question.
Right.
You know, there's the elimination technique.
Right.
Shout out to all the amazing, what do we call them now? Instructors out there that are really doing, because you guys are really, really helping a lot of nursing students, new grads. I just wanted to put that out there. Shout out to you guys.
Yeah.
All right. So did you use the person view trick? Do you know the person view trick? I think I asked
you. Told me. You told me about that. I didn't even know that. You told me about that. I didn't do that. I just waited.
This guy is strong. Where village are you from? Please share it with the class.
Oh goodness. No, I just had to be.
I didn't do that on my 5th attempt when I passed, but I did that like.
I didn't pop up stuff. I didn't know about it until you told me about it. And then I saw my classmates talking about it in a group chat. I'm like, what is that? I just waited I don't know the word for whatever was going on in my head. Hey Chimo, I don't even know how many days passed. All I know that I was just in. Hey, I went to the upper room. I think that's where.
Nancy and upper room. God, I beg. I wanna be.
Upper room when Lord is.
I think it's actually 48 hours.
Yeah.
So yeah, sorry guys, it's 48 hours, not 72 hours, because I feel like we said 72 hours.
Even after 8 hours already, it's
already long. It's already like 1 year.
I wish they can reduce it, honestly, because people
those
cry.
Those people are doing
people cry for no reason within 48 hours.
I didn't want to remember it. Like, I'm not even kidding it. It feels fresh all over again. Okay, next question is, what is one mistake you think people should avoid when preparing for the Nclex exam?
The mistake has to be comparing yourself to other people and using so many resources, because that was actually a mistake I was making on the first week. Because the first week I was using Simple Nursing. Simple Nursing has good videos, so good, like
very educational.
Yeah, very educational. And then they had because I did subscription for Simple Nursing as well, so I was also answering questions.
I say now one.
No, I did that when I was still in school. When I was working.
Okay.
So, because I wanted to use it for my class as well. So I was using Simple Nursing. I was using Kaplan. It was free for us in school. Okay. So Kaplan, host review, Chimo. I used everything.
Yeah, that's a lot.
Yeah, and then
because they have different teaching techniques, so it's going to definitely
and then the question too, everything is different. Yes. So now you're getting this here, getting this here, getting this here, getting this here. Like, hey, Chimo, give me. So
it's not me about giving a mail for
like what is happening.
What is that? Because I didn't know what she's saying.
Forgive me. We have to calm down and face one thing. I decided to go with Archer review because of the explanation after every video was better for me with Archer. Kaplan was good too, but I feel like the difficulty with Kaplan and
what was that expression?
I don't even know. Kaplan and host. But you have to know the content before you go there, kind of, or else you have to actually be patient with them.
So basically, try not to get yourself involved in too many.
Pick one and stick with one and grow, and then maybe you can now try other, like you can now practice questions. By then you have more knowledge.
Last question. I know I've really enjoyed myself. I don't want this question to end. I don't want this video to end, but I don't want it to be too long as well. What is one advice you would give to a future Nclex test taker? What is one thing you say to someone that is preparing for the Nclex now, or someone that, you know, failed the first time, failed the second time? I mean, there are people that have reached out to me after like my video on, you know, how I shared how I passed on my 5th attempt, and they're like, they're still struggling to take this exam. What is one piece of advice you would say, or you would give to them rather?
So the thing is, I know for sure that not many people have the privilege to just put everything on hold to take this exam.
That's true.
I was privileged enough to put everything on hold and take the exam. At least my family, they kind of supported the idea of me putting everything on hold. But not everybody has that privilege. So, but what I can say is, but I've been in a situation where I had to work and go to school, right? So I know the struggle of that. So something that you can do is, if you are in a situation where you have work, you have kids, you have a lot of things going on, you don't have to practice 85 questions a day. You get? So now you can do 30 questions a day. You can do 50 questions a day. Start there. You get? And another thing you want to do is you can write out topics you know yourself. You know yourself.
You know the area.
You know yourself more than anybody. You get? Even when you are in a group chat, like the way I was in a group chat with everybody, you know, we respected the fact that we are not similar. We have different. This one is perfect here. This is perfect here. This is perfect here. This is perfect there. So we know, and you should know too. You get? So that's area where you need more study, more resources. You know, you can focus on that. one mistake people do is that they only focus on med surg. They focus on medicine and surgery, where they just know, but they forget that they can also ask you pediatrics. They can also ask you maternity. They can also ask you psych. My sister got more of psych. My friend got pediatrics. You get me? I got med surg. We thank God.
And you had what? You say you had case studies too. So that means they can throw a scenario.
The case study
they want to test your critical thinking ability.
So don't focus on just, because remember you're taking the next gen Nclex, right?
Yes.
So anything can literally, like, they can question you on like anything. And even though there's this thing called bow tie. You can even literally have more of both ties in your Nclex exam. Do you get? So, and somebody else might just have select other apply. Somebody else might just have this. Do you get? Mine was more of case studies. The case study there was a lot, man. Anyways, so the point here, my point now is that write out every question, every topic that you know you need more study on, and read on that. Practice like 30 questions, maybe in your resources, whatever you're using, Archer, whatever you're using, anything you're using, then you can select just maternity today, and then you do 30 questions on maternity. You get? So now there's maternity, there's pediatrics, there's psych, there is medicine and surgery, there's what else? There's fundamental, there's a lot of things.
Yeah, there's a couple, there's pharmacology.
Yeah, pharmacology, there's a lot. You get? So you can do like this week now, like every day of these 7 days in a week, right? Every day I'll do 30 questions on maternity, or I'll do 30 of maternity Monday, 30 questions on pediatrics Tuesday, 30 questions on this to get, and that way, you familiarize yourself with every point, every dot, you don't miss anything. So that's the one mistake people make. They just focus on one thing and then leave the rest.
Yeah.
And then on the exam, they'll now have things that you're not prepared for.
They're confused.
Exactly.
Yes.
So just write out your plan. You have to write it out. Don't just think about it in your head, because you can get overwhelmed.
Yes.
So write out your plan. Write everything out and be very realistic. You get? Don't be too hard on yourself. Don't do the one that you know that you cannot do. You get? Because of your schedule and because of your engagement.
True.
So be very real and be very realistic, and I think.
And just know that it's possible. Don't ever feel like you can't do it.
Anybody can.
I'm telling you, like I've said this on this channel before. If I, Oluwateniola, if I could pass the Nclex exam, anyone can pass the Nclex exam. Anything you set your mind to do, it will happen. It might take time, but it will happen. And most importantly, commit it to God's hands, because you really cannot. You can't know everything. You can read on everything.
True.
You can have an idea on how to answer these questions, but at the same time, you need God's help.
And Dr. Sharon's videos will literally save your soul. I'm telling you.
Okay. Please, guys, go to Dr. Sharon.
No, for real, I'm not even joking.
I've actually never heard of Dr. Sharon. Or maybe I've seen her face.
Okay, I actually not even heard of it. It was my classmate that took the exam. He took the exam and passed, and he was like that Dr. Sharon helped him. The way I ran.
Wow.
I ran and I watched the videos, and I'm telling you, because I was really scared for pharmacology. Pharmacology is my weakest area, And I was like, okay, because I cannot know all these meds, and you don't know where they'll ask you from.
Yes.
And what Dr. Sharon will do is that she will help you answer that question, even without you knowing that medication. For real. So make sure you share that link.
I'm going to check that Dr. Sharon lady out.
No,
that's very cool. That's cool.
Yeah.
That's cool.
Yeah. Even with the prioritization questions and all of that, strategies, a lot of that apply, so many things.
And I feel like this new gen, like Nclex, is, I don't know, but I think it's better than what it was, in the sense that like they're giving like partial credits on like.
Oh, but if you fail it,
before
you minus mark, right? Is
really?
Yeah. If you fail, so I don't know. I cannot say for sure if. So what I did was I only selected what I was sure of.
Yeah,
and that's let all that apply, because you don't want to pick the one that you don't pick -1. That's how it is.
Wow.
I actually thought it was just.
Yeah, that's what I thought too.
It's actually -1 if you fail one.
All right, guys, so we've come to the end of this video. Thank you
for
so
watching.
much.
I hope I didn't talk too much.
I hope so too. Well, thank you so much for coming on this channel, and I really appreciate, you know, everything that you said. Thank you for sharing your story, and I hope to have you back again.
Of course.
And I hope you guys learned one or two things. And but yeah, just say congratulations. Let me finish.
Okay.
Please congratulate her in the comment section.
Thank you.
She is the latest registered nurse in the United States of America. If it is, it run now. If it is, it run now. But yeah, I hope you guys enjoyed this video. I enjoyed it.
Yeah, thank you guys for having me. It was really nice sitting here. Like.
Alright guys, so I'll see you in my next video. Please do not forget to like this video, share and subscribe, and do well to watch my previous videos, and let's talk in the comment section. Okay, bye.